This will be recorded for our League of Women Voters YouTube channel. So welcome to this public event sponsored by the Washtenaw County League of Women Voters. My name is Sarah Fink. I'm a member of the League interested in healthcare access. And before we get started on tonight's program, is that coming through okay? Just want to make an announcement about another League event that's coming up in a couple of weeks. If I got it right. Monday, October 27th, we have a presentation at an Ann Arbor library, How Does ICE Impact Washtenaw County? And that will be Monday, October 27th, 6 to 7:30 p.m., Ann Arbor District Library, the Westgate branch that's off of Jackson Road. And you're invited to a presentation. Speakers include our Sheriff, Alicia Dyer, Melanie Harner, who was a co-founder of Wicker Washtenaw Interfaith Coalition for Immigrant Rights, and Andy Labar, Washtenaw County Commissioner. There may be other people involved once the event actually occurs. And that event too will be recorded and posted on the League's YouTube channel. I just want to add that the League of Women Voters is a nonpartisan political organization. We encourage informed and active participation in government and work to increase understanding of major public policy issues, of which, of course, healthcare, especially right now, is a major one. And our speaker tonight is Ruth Kraut. She is the Deputy Health Officer for the Washtenaw County Health Department. Prior to this position, she was the administrator for the Washtenaw Health Project. In that role, she worked extensively on access to health care. And tonight she'll tell us about what she can about the shifting outlook for access to health care in light of projected federal budget cuts and uncertainties at the Department of Health and Human Services under Secretary Robert F. Kennedy. So, Ruth, you're up.
What? Go ahead.
Let me add one more thing. We'll take questions from the audience after the presentation. Thank you.
Okay, can you hear me at the back? Okay. So when Sarah asked about this, I said, things are changing a lot, and I'm not really sure what I'm going to be able to tell you, but I really wasn't expecting that a federal shutdown would be added to the mix. So as my grandmother would say, and how? You know, it's a big mess. So we'll try and I'm trying to balance keeping it high level, but when you have detailed questions, we'll see if I can answer them. Oh, I do have some handouts. I'll give you the handouts out later. Yeah, because they're really for the end. So first, just a little bit about our Washtenaw County Health Department. How many of you feel like you know something about the health department? Okay, good. Oh, so we like to say we are your prevent and protect department. We provide immunizations, health services, public health education. We're your Healthy Kids and Families Department. We have programs like WIC, Women, Infants, and Children, which is a nutrition program. We have programs like the Maternal Infant Health Program. We like to think we're your peace of mind department. We have a whole emergency preparedness wing that's related to lots of emergencies, but among them COVID, bird flu, back in the day, anthrax. And your Safe and Sound department, we've got a whole environmental health division. Our main office is over on Towner on the east side of Ypsi, but we also, over on Zeeb Road is where environmental health is. Your restaurants that you feel safe eating at, that's thanks to us, septic systems, etc. Lots of different, we do a lot of tracking of communicable disease. We help people who are worried they woke up and there was a bat in the room, give advice around things like rabies. We do septic, sewer, And just to go over kind of our vision and guiding principles, our vision is a healthy community where every resident has the opportunity to achieve optimal health and well-being. So we say we value all people equally. We promote the improvement of living conditions. We strengthen partnerships with community members, and this was a very big focus during COVID. And we name racism. We're not backing down from the use of words like health equity. In fact, we have a health equity manager. So hopefully this will be a little bit interactive. And where we're gonna start is back in 2010. On the left-hand side, hopefully you can see this well enough, can anybody tell me who they recognize in that photo? On the left-hand side.
Schumer, yes.
Okay. You see Chuck Schumer?
Biden.
You see Biden, okay. What was his role at that point?
Vice President.
He was the vice president.
President Obama.
Okay, President Obama.
And Nancy
You see Nancy Pelosi there, that's correct.
Ringo.
Who is sitting there? Dingle. Dingle. And Ringle. Oh, okay. Yes, okay, both. Okay. So what are they doing there?
signing the Affordable Care Act.
That's right. They are signing the Affordable Care Act. And the reason that John Dingell has pride of place right next to President Obama is that his father was in Congress and introduced healthcare legislation every year. And when he got into Congress, he also started introducing healthcare legislation every year. It didn't get traction till President Obama was there. Now let's look at the right-hand side. What is that? Who is that?
Governor Snyder of Michigan.
That is Governor Snyder, and it says he's signing the Medicaid bill. What are they talking about? That's right, the Medicaid. I'm just going to repeat because not everyone can hear. That was the Medicaid expansion. Back in the day, and in some states still, Medicaid was for select populations. Mostly you had to be poor, plus you had to have another qualifying condition. So you had to be poor, plus you had to be a child, you had to be poor, plus you had to be disabled or a senior citizen. With Medicaid expansion, essentially the expansion meant that you just had to be low income. And this has been a major change. So when we look at the state of our state right now, we owe a lot to what happened both with the signing of the Affordable Care Act and with the Medicaid expansion. So I don't know if people know this, but here we are, we're 15 years later because actually this was signed in 2010. So here we are in 2025, and the Affordable Care Act is still at the center of the fighting. It's one of the main reasons that we've got a shutdown right now. So I just thought that was like a cute little fighting gif. But really, marketplace insurance subsidies are a very large piece of this. In some ways, a lot of pieces of the Affordable Care Act are still being legislated and fought over, even though I think the Affordable Care Act is settled law It was not perfect, and there have been changes along the way. Okay, so I just think this is a cute little graphic that we did a while ago, but the ACA, that's the Affordable Care Act, your life has been changed by the Affordable Care Act. Raise your hand if you think you know how your life was changed by the Affordable Care Act. Okay, a few people. We'll get to that in a second. Do you feel like you understand your auto insurance? Raise your hand. Okay. Do you feel like you understand your health insurance? Okay. Okay, so let's just run through some of these questions. What are some other names for the Affordable Care Act? Obamacare. How about PACA, the Patient Protection and Affordable Care Act? I think that's its official name. What are some ways that your life or the lives of your family and friends have been changed by the Affordable Care Act?
Keeping kids on insurance until 26.
Right, keeping kids on insurance until 26. And I actually have a son who turned 26 last week. And luckily, he will have an option for employer insurance. But okay, so that's one thing. Yes?
Well, the ACA has been demonstrated to have vastly increased access to health care among widespread
Okay,
populations
so a
in the
lot,
United States,
yeah.
which indirectly helps everybody, because if that guy over there is getting health care he otherwise wouldn't have gotten, he's less likely to communicate an illness to you.
Okay, so your point is that it reduces risk to everybody else
Right.
if more people have health
And
care.
I would argue it reduces cost.
And it typically reduces cost because when you have, I can use myself as an example. When I was 22, I didn't have health care anymore because I had graduated college, and my parents were worried about that, but I wasn't worried about it because I was healthy. But they knew, what if you break your leg? What if you get diagnosed with some terrible illness, right? So they were worried about it. And if, in fact, I had been diagnosed with a bad illness, I would have tried then, right? In other words, people who are sick are more likely to want the health care. So you end up, in insurance terms, with a smaller pool of people, and they tend to be sicker. So when you spread out the cost, you get 21-year-old me on that health care. What else? Yes?
You can't be booted off for a pre-existing condition.
Okay, it's not just being booted off, but back in the day, if you had asthma, your insurance might say, I will cover everything for you except your asthma. Well, that's the only problem I have, so what's, right? So, yeah, so pre-existing conditions, you can't be kicked off for that. Anything else? Anybody here get a flu or COVID shot recently? How much did it cost you? Zero. Okay. What would you have paid before the Affordable Care Act? You would have paid out of pocket. Preventive care, same thing if you had a mammogram, a screening colonoscopy, all those things, preventive care is covered. That's not the same as if you say to the doctor, I have a lump in my breast. That's not screening, but if it's just routine screening and vaccines, covered. What else? No? Okay, well, I'll just mention one more thing, there's a longer list, but just to mention one more thing, well, two, the Medicaid expansion and the marketplace, both of those being created. But there used to be sometimes pretty low caps on what your health insurance would pay, which if you had something maybe didn't matter most of the time, but if you had something catastrophic happen, could be a really big deal. What is the Medicaid expansion? I referred to it before. Yeah, Sarah?
The federal government, up till now, has covered 90% of the additional cost of putting people on Medicaid in the states that accept.
Okay, that's what we start talking about financing, but I'm not asking, but like, yes, the federal government covers a lot of the cost, the vast majority of the cost, but what exactly is it? Yes.
It lowered the eligibility criteria. Before you had to be poor plus disabled.
Exactly.
Now it's just poor.
Right, so this is just income-based Medicaid, and it generally covers a tremendous amount of your health insurance costs. It's very, very good health insurance. And in states that have accepted it, it's been shown to save lives. Now, our Medicaid expansion program here is called the Healthy Michigan Plan. So for adults. So if you hear about the Healthy Michigan Plan, that's what we're talking about, is the Medicaid expansion. So we kind of talked about this a little bit, what influences the price of health insurance, right? And that is the size of the pool and the cost of things that get used. So if you hear the people talking about an expensive medication, new medications like Ozempic and Wegovy, if you talk about like very expensive genetic-based medications, right, though that can influence the cost. But what also influences the cost is who opts in and who opts out. So people who opt in, if people who opt in are largely healthy, that's going to lower the cost. If they're largely sick, that's going to raise the cost. Insurance companies need to cover their costs. Do you know where people get their insurance from? I get mine from my employer, so I'll start us out, okay?
Isn't it still 40% that get insurance through their employer? Or is it
We'll look at the numbers in a minute, but besides employers, what? Marketplace? What were we just talking about? Something expansion. Medicaid? Yes. Anybody here been in the military and VA coverage? How about for those of you who are over 65? Right. So, what are work requirements? Sorry. Work requirements are something that they're trying to put in place that people who are able-bodied can't just be poor. The idea is that if you are poor, but you're able-bodied, that you have to be able to work. Now, things keep changing, right? Our state budget passed. We have a federal shutdown. HR 1, that is President Trump's signature piece, which is also called ABA, passed in the spring. And this is a huge influence. And there's a lot of stuff that's in the ABBA bill that is causing a lot of lawsuits. It's really hard, really, really hard to keep track of them. Thank you very much. Yeah, so we're gonna, by the way, I did send these slides to Sarah, and there are some links in them if you want to share them out. Because if we talk about keeping track of lawsuits, there are lawsuit trackers. Okay, so there's an organization called the National Health Law Program, and I stole this shamelessly from them. But here are some of their concerns. We have learned from prior big changes that harm can be great, and especially if it's done quickly, it can be irreversible. We're working with a very, very short timeline. And so complex system changes make harm more likely. So just as an example, SNAP benefits or food assistance, there was a timeline to implement work requirements, and it just got moved up to November 1st. So that's a very, very short timeline, and there are some changes in it that previously people would be exempted if they had children under 18 in their house, and that's being dropped to age 14. We think about our Department of Health and Human Services staff, our state, they're the ones who administer things, and it's going to be very hard for them to administer these effectively when we have very, very short timelines. There are cascading effects from things like, with Medicaid, needing to, part of the ABBA bill is to go to 6-month verifications. Somebody has to process those. We're not getting more staff. Department of Health and Human Services is not getting more staff to process those. And people have to return the mail, so prove that they're still working or prove that they're looking for a job or any of those kind of things. So this is a huge demand on our eligibility workers, on call center staff, and on our beneficiaries. By beneficiaries, that's the person who's got Medicaid. And now instead of needing to do a renewal once a year, needs to do a renewal every 6 months. So keeping in mind that our community is part of a much larger state and national ecosystem, right? So you know about our county probably that we have over 370,000 residents. I don't know if you know that 40,000 of them, almost 41,000 are currently enrolled either in the Healthy Michigan plan or straight Medicaid, but that doesn't include kids, that's just adults. We have 28 local governments, and you know, they're all doing their own thing for their people. We got 9 school districts, 6 colleges and universities. Now roll that up into our state and into our federal government. Impacts will be felt widely. So the ABBA bill was signed into law in July of 2025. It has a lot of provisions in it, and I think many of them are controversial, as you can see by the number of lawsuits. It slashes funding for a lot of federal programs. So that includes SNAP, which is your food assistance benefits. It includes the Medicare, the Marketplace, Medicaid. It slashes food for food insecurity systems. And here I'm talking about not SNAP benefits, but the systems that have like food surplus programs that have supported food gatherers and gleaners in Livingston County and those kind of programs. The Congressional Budget Office estimates that $1.1 trillion of predicted cuts. 1.1 trillion. I know that's a big number. Remember, that's across all 50 states. But one of my coworkers did see a cut at the state government that said billion, and she said, "Is that right?" Yes. Our state budget is billions of dollars, right? So the crux of the shutdown right now, one of the biggest things that one of the biggest reasons that the Democrats are not supporting the continuing resolutions has to do with the Affordable Care Act subsidies. We'll get a little deeper on this in a minute, but they're estimating that an additional 15 million people could be uninsured because of all these changes. So here's some examples of changes that will be happening in 2025. Changes to streamlining Medicaid enrollment have been blocked, but there is a ban on Medicaid payments to nonprofit abortion providers, and that basically was written specifically for Planned Parenthood, which 95% of its support of its work is not related to abortions, but they're already nationally having to close locations. No access to the Marketplace for DACA recipients. DACA is the program for kids who came when they were young with undocumented parents. Used to be able to get the Marketplace. Now they will not be able to. The expiration of enhanced premium tax credits. So I said before, the Affordable Care Act, not perfect. One of the things that was not perfect is that people had to pay a lot for their insurance. And in the middle of the COVID epidemic, the Biden administration expanded the premium tax credits so that there were better subsidies. So that's what is being talked about being rolled back. Another thing that's being talked about rolling back is special enrollment periods for low-income individuals who maybe did not. So one thing about Medicaid, you can get on any time of the year. If I lost my job tomorrow, it doesn't have to be a special enrollment period. I could apply for Medicaid. But as most of you know, if you've had employer insurance or Medicare Marketplace, there's an open enrollment period. So these are just examples of some of the changes that will be in 2025. Now in 2026, a much smaller group of qualified immigrants will be eligible for Medicaid. That is, assuming all this continues to happen. There will be changes to immigrant verification. In fact, some immigrants could be eligible for Social Security because those rules haven't changed, but not for Medicare. There will be a match for a federal match reduction for emergency Medicaid, which is for people who are not eligible for regular Medicaid. Shorter Marketplace open enrollment period. So whenever you reduce the time that people can get covered, some people miss out. and changes to recapturing excess premium tax credits, which what that means is, let's say I said my income next year is going to be $50,000 and I actually made $80,000. It used to be there would be a cap on what I would need to pay back. In the future, that won't be capped. So if I got a bigger subsidy, I'll have to pay the whole thing back. Medicaid renewals changing to twice a year. Medicaid work requirements starting. Reducing retroactive coverage for Medicaid. So let's say you don't have health coverage and you end up with a big medical bill because you got appendicitis. Right now, you can go back 3 months for coverage. You'd only be able to go back 1 month. And limits to immigrant access to the marketplace. So lots of changes. If I just overwhelmed you, I'm just going to say that that's part of the plan, is to overwhelm.
Can I ask a question?
Yeah.
When you say marketplace, is that basically the same thing as the Affordable Care Act, or does it include Medicaid?
No, so it doesn't. So the Affordable Care Act is much more than health insurance, right? Because we just talked about like it's a lot of changes to health insurance. And the invisible side, there was a lot of changes to the financing on the back end, which I'm not really going to talk about. But we have, for low-income individuals, we've got the Medicaid expansion. And if your income's a little higher, but I have several friends who are psychologists, and they have their own businesses. They are self-employed. They have to get insurance somewhere, and where they do that is on the marketplace. Okay, so it's also called the healthcare exchange, and that is where people above 138% of the poverty level can get health care if they don't have it from their employer, from Medicare, from military service. So what's going on? So we have a lot of lawsuits in progress. And some of them are going to stop some of these things. They're not all going to be successful. Some of them won't. I don't know which will and which won't. Lawmakers may feel pressure from constituents. Actually, 70% of the people on the market place are in Republican-led states, and that is because some of those Republican-led states have not expanded Medicaid. So maybe there'll be pressure. But generally, if we think about trickle down, and not in the good way, but federal changes affect the state and the state affects the local. How can we track all the changes? And this is where you may want to send this out because these are just links. Kaiser Family Foundation has a tracker that is just about HR 1. They also have a policy watch. Beyond the Basics is doing trainings about new laws and policies. The Michigan Attorney General, if you would like to know what our Attorney General has filed or joined, they've got a tracker. And there's also a reproductive health litigation tracker that the Kaiser Family Foundation has. So all of those, and we probably missed a few. I'll tell you the truth. I have a social work intern who's been trying to put together like an executive summary, and whoo boy, it's been challenging because I think every time she comes into the office, she has new information. So this is an example of our Michigan marketplace enrollment from 2014, where we had about 275,000 people on the marketplace, to 2025, where we were, I think, at 540,000. I put a little arrow at 2022 because, as you can see, the numbers went up there. Do you know why the numbers went up there?
Expanded tax credit.
Right, so that is exactly when the Biden administration, as part of the American Rescue Plan Act, put in enhanced premium tax credits. And what that really did was make the costs much more affordable. You know, health insurance, even if your employer is offering it, it could be super pricey. By type in Michigan, only the good news is, this is from 2023, and it's from the Citizens Research Council, which has a lot of good issues briefs if you're looking for anything. Only 3% of 0 to 18-year-olds were not insured. And over half are insured by employers, and almost 40% were insured by Medicaid. That's kids. Then if we look at adults, 19 to 64, so that's excluding seniors. 63% are covered by employers, and 22% are covered by Medicaid. Just to give you an idea, that non-group insurance, that's 6.8%, that's the marketplace, mostly. State budget. Okay, so there's good news. We have a state budget. I don't want to take that for granted, especially in light of a federal shutdown. And from my point of view, very good news. They really have kept the majority of cuts away from public health. We do have some concerns, like WIC, Women, Infants, and Children. That funding is federal funding, comes to the states dole it out. We are okay. And the way WIC works is you come in as a pregnant woman or with little kids, and you see a nutritionist, and you get funds. You get like an EBT card, electronic benefits card, that you can use for certain types of food, like milk and cheese and cereal and fruits and vegetables, right? So right now with the federal shutdown, there's money for, I think, about another month. So this is a concern because the state government doesn't have the money without the federal government, right? So that's where we get the concern. That's not the only program that comes federal to state, but that just is an example. And in the future, the state is likely to experience a loss of federal Medicaid revenue of at least $2 billion a year. And that's related to more than one thing. It's not one thing. It has to do with match rates that we get from the federal government. It has to do with the number of people who are getting Medicaid. So it's a very confusing situation. We have uncertainty, as many of you know, about ongoing vaccination coverage, about gender-affirming care for individuals who are trans. I didn't put reproductive care up there, but I definitely should have. Release of Medicaid data for immigration enforcement. So there's a lot of pending concerns out there in addition to the funding issues. So then we come back to this loss of funding for public insurance increases strain on the entire healthcare system, and you may have heard that some rural hospitals are extremely at risk from this. Even in our relatively well-off systems, we've got Michigan Medicine having 13% of its income from Medicaid, and Trinity Health having 17%. And the Department of, Dept, Insurance and I forget what the F is, Financial Services, they're estimating that 120,000 Michiganders would lose marketplace coverage. We have experience with work requirements in the past, so we know they're a huge administrative burden and ineffective hurdle. Keeping insurance from immigrants places stress on our safety net providers. You may need help. You may know somebody who needs help. We have a really wonderful program in our county, the Washtenaw Health Project, and you can call them at 734-544-3030. You can email them at whp@washtenaw.org, or you can just walk into the same building as the health department, 555 Towner, and get help. And they are really great at helping you figure out what exactly are you eligible for. Because you don't know, and your income goes up and down, and now your sister's kid is living with you, and are they part of your family or not? Like a lot of people, some people just have one job, one income stream, but a lot of people have very complicated lives. And the gig economy is real, right? So this is a great place to get help. I mentioned I had a handout, and that is a handout about vaccines. I will give it to you at the end of the meeting, because I know you can't read this, but basically, bottom line, you can get the same vaccines that you thought you could get in June, you can still get this fall. And I encourage you to get your COVID and flu, and if you need it, your RSV vaccine. I'm not going to go over that, but I do have a handout so you can take it home and read it over. And it comes from a writer who calls herself Your Local Epidemiologist, and she has a really useful Substack. Here's some information about how to connect with us. You may not know that we have a weekly email if you want to keep up with things. We've got a website, social media. You can email us your questions. If I do say so, we're pretty good at getting back to people. I love that everybody's taking pictures. If you have questions, here's my information. And that's it for me. So I'm open to your questions now.
Thank you very much, Ruth. So anybody who would like, are you going to hand them out? And,
Great.
So I have emails, and I will send out what Ruth sent me, the PowerPoint. And if anyone else would like to get that, please, please just come up. I'll get out a pen, and you can write down your email address. And I will send that out to non-lead people that I don't already have the email addresses of.
And the caveat I want to say is that this stuff can change at any time. So if there's a few legal cases and in 3 weeks you look at this and you're like, that's not exactly right anymore, that could be the case. So we're constantly learning about changes.
So does anyone have any questions?
Thank you very much, Ruth. Tremendous presentation. Thanks for taking the trouble, particularly since you're not getting paid, and so thank you for doing it on your own time. Thank you. But what is the outlook? I mean, it isn't funny, and I've had my political viewpoint surgically removed because of the league, so I can't express what I'm really feeling about what we're all experiencing, at least those workers who are, laid off and so forth. But if by design at the federal level, the shutdown continues for months and months and months and months, what's your view on how that cuts in Michigan as regards healthcare coverages? Does it worsen stuff? Does the stuff worsen than what your projections are?
So I would have to say, I don't fully know what happens if we have a federal shutdown for a really long time. One possibility is that can't happen because there's so much pressure on programs. Another possibility is that they start piecemealing, providing programs. In fact, I did hear a proposal floated, just as an example, that tariff money could be directed just to WIC. But I'm sure that all of you are sitting in this room and thinking, well, WIC is not the only program that I'm worried about, and right, we shouldn't be. The federal government funds a lot of our state work. And so I think we're just in a point where we really don't know. And also, you have to kind of weigh the harms, right? So the Democrats have really focused on the tax credits. There are other harms also. So I don't think I'm in a good position, but I don't think it goes well. And as it happens, I was on a plane yesterday, and all those TSA workers, they're all staffing, but they are not getting paid. Okay, they are not getting paid, but they were all there at work, and they treated me very nicely. So that's mandated workers. That's a whole nother issue. Carolyn.
So you say immigrants. So I saw you pointed out DACA. That's one group. Is it on?
Push it again.
Okay. So it's just so hard for me to understand that they could stop immigrants. What does that mean? Stop immigrants from getting health care? I mean, it just seems so, what are they to do?
So documented immigrants have always, under the Affordable Care Act, have always been able, and under some past regulations before the Affordable Care Act, have been able to get health insurance. An example of sort of categories that could change is that in the past, refugees were automatically able to get insurance, whether Medicaid, the marketplace, or anything else, from the moment they set foot and had all their paperwork processed. Under some of these proposals, then they would not be eligible for Medicaid. So that's just one example. I'm glad that you're going to have a presentation next month on this, and it's really complicated, but there's a lot of different kinds of changes.
Thank you for coming out. We appreciate the information. My name is Andre Watson. I'm the president of NAACP in Ann Arbor.
Oh, welcome.
Thank you. Thank you. And I'm here with our executive chair, Janice, who invited me out.
Okay.
So thank you all. My question is, overall, we've seen quite a bit of targeting. Specifically, it appears to be African American or minority communities from this current administration. Do you see that same consistent trend in what you understand about the adjustments that you're able to see better than us? Do you see it?
I think sometimes it's explicit and sometimes it's not. If we sort of start from the point of view that we know that a higher proportion of people of color are poor, then changes to Medicaid are going to disproportionately affect all poor people, but it's going to disproportionately affect people of color. So that's the kind of thing that we're seeing. It's maybe not so explicit, but its impact can still be very, very significant. We also have at the federal level, and this does not relate to ABBA, but there's been several executive orders that have said, for instance, that you can't call out services to particular communities. So you can't call out services to the African American community. You can't use the word equity, or those are just a couple of examples. There's hundreds, at least hundreds of them.
And what can we do? It's time for us.
Yeah, I think it is really important to talk to your legislators, and that I know that can be really hard because many of us have many things we want to talk about, and so what's the highest priority? If you can organize to talk about specific things, to meet with legislative staff. Of course, I'm talking to the League elections, and the NAACP elections really, do matter, and small numbers can make big changes. So, and I also would say don't give up hope.
One topic
You didn't talk about very much was mental health. And locally, we've had some initiatives in that direction, but it seems that keeps getting more and more of a healthcare issue.
Right. Well, I didn't talk about mental health on many levels. I mean, one part of the Affordable Care Act says, health coverage includes mental health. Your body doesn't end right here, right? So that's, there have already been cuts to mental health and substance use services that have directly impacted some of our local programs. And on the flip side, and this is where local work is really important, we do have a millage that supports community mental health and policing. And that community mental health support has been able to mitigate some things, and I think will continue to be able to. So that's where local work is important. And if you were living in another county, your substance use programs might have had the same cuts, but you wouldn't have any support. All right. Thank you very much. Take care. Come see me if you...